Hello, my name is Savannah Shield, and I'm doing my oral presentation on cervical cancer. Who's at risk? Women, of course. Women who are over 30 have a higher risk. Women with HPV, women who are having unprotected sex or sex with more than one person, women with weakened immune systems, or women who smoke or inhale secondhand smoke. Causes of cervical cancer are high-risk HPV, where the cells mutate and become abnormal. There's two types of cells. There's the squamous, which is thin, flat, square cells in the outer part of the cervix, which is also the most common, or the endocarcinoma, which is column-shaped cells in the cervix, or in the cervical canal. Symptoms early on are vaginal bleeding after sex, menopause or in between menstrual cycles, discharge that can be watery or bloody. It can also have a foul odor, and pain in the pelvis or pain during intercourse. Later symptoms could be anemia due to all the blood loss, constant pain in the pelvis, legs, or back regions, urinary problems or blockages, leakage of urine or stool into the vagina, or weight loss. Testing, the first steps is usually a pap exam where they take cervical cells to see if there's any abnormalities, and then they can actually take those cells and do a HPV DNA test to determine which types of HPV are present. Then they can do a punch biopsy if they find abnormal cells, which just pinches off a small piece of the cervix to be tested. Or they can use a spoon-shaped instrument called a current to also take cells. They may do a leak procedure if they need a larger portion to test, which is just a small metal wire loop that has electricity. Or they can do a cone biopsy if they need to get deeper into the cervix to get a larger portion to test. There's 4 stages to cervical cancer. Stage 1, the cancer is contained only in the cervix. Stage 2, it's in the upper part of the vagina and cervix. 3, it's moved lower and into the pelvic wall. And then stage 4 is it has spread to nearby organs or other areas of the body. Treatment, surgery, they have simple hysterectomies. That if it's caught early enough, they can just take the cervix and the uterus, or if it's caught later, they can do a radical hysterectomy where they take the cervix, uterus, and part of the vagina and the lymph nodes. Or they can do radiation internally, externally, or a combination, and it's paired with chemotherapy, which is medication